Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Cancer as a condition is just something where you have cells grow abnormally and then invade others, and also they have the ability to spread to other organs. The breast is a glandular tissue. It secretes milk. So the cells in the lining of those glands grow abnormally, and then they invade other cells, and then it spreads on to other tissues. So it's either the glands, the lining of the duct, or the lining of the lobules, and all that is the glandular tissue. And then it will spread into the armpits, it will spread into the chest, the liver, and so on.
So what then are the causes or risk factors? And you said this moves hand in hand with who then is at risk and why they would be, predisposed to breast cancer.
People who develop breast cancer have a few components that make them more likely to get that disease. About 30% of breast cancer are due to modifiable causes, and then the rest is associated usually with the non-modifiable. But that said, you could have no risk factor and still get that disease. One of them is being female. Over 99% of breast cancer patients are women. In some areas, it's as high as 99.5%, but in others, it's about 98%. So they say only about 1% of breast cancer patients will be men. The other is genetically inherited factors. Then you're having your first menstrual period as a woman before the age of 12, and also going into menopause after the age of 55 makes you more at risk. And this is just thought to be because breast cancer moves through the hormones. It works through hormones. So these women have a longer exposure to hormones. And the last in that category would be women who have dense breasts. Dense breasts, not because you see them and they're big and dense in the fact that in regard to the fact that when they do an X-ray, which is a mammogram of the breast appears like it has very little fat. So it's darkened and it's harder for a lump to be seen. World over, 1% of breast cancer patients are men. At the Institute, over the last few years, I've been there about 4 years, and I think we've recorded, a year when we had about 60 men. Out of the 1,000 breast cancer patients recorded, about 60 of them are men. But men tend to have more aggressive disease because, one, they have less breast tissue, they have less, so it spreads a little faster. So for a man who finds a lump in their breast,